Ticket Health is your company, and you're trying to help organizations and their populations. Tell us about the problem that you're trying to solve.
Yeah, we think there's a fundamental problem that actually transcends any one of the moonshots. It applies to all of them in that getting accurate, honest information from people in the care process is a real challenge for healthcare providers as well as other individuals that are supporting people in the population. Could be teachers, could be members of the community organization, whatnot. The way that questions are typically asked, not just by physicians, but also in the context of surveys or assessments, can be very threatening to individuals and stigmatizing, and they start to shut down and not provide the actual honest information that individuals need to provide appropriate care to them. And we're solving that problem.
When did it become clear that there was a need here that can be addressed with technology?
Yeah, it's a great question. So it actually goes back to the founding of the company and the pediatrician, Dr. Sandy Whitehouse, that instantiated this idea roughly 20 years ago in her clinical practice when she realized she was struggling to get information from her patients, of course, children at that time, asking them things like how much pain are they in, do they have anxiety, things along those lines. She realized she wasn't getting accurate information, and so she put herself back into school, got a degree in communications, and then came back and started ideating in partnership with researchers around the idea of, rather than asking text-based questions, using imagery, icons, graphics, etc., to facilitate a more honest communication with the patients. And she found in these clinical research projects that it resulted in higher sensitivity and higher specificity both in the data collection process.
Okay, so how's it work? Who's the ideal person for this technology?
Well, it's any organization, quite honestly, that is trying to provide some level of care to a population. So in the classic healthcare sense, it could be a clinic, it could be a hospital around a particular population. They're trying to get information. For example, let's say the hospital is trying to do chronic disease management. They're trying to get to the root cause of why an individual is not taking their medication, they're not quitting smoking, they're not sticking to their diet, whatever it is that's supposed to be happening. Because some of the reasons for this could be based in traumas in their past, it could be related to social determinants of health issues. I can't afford the medications. These are things a lot of people don't want to just open up and offer as honest information, and that trips up the process because it puts the physician or the clinician in a position where they can't actually address the root cause of the problem.
So it sounds like a combination of maybe shame, pride, barriers in communication could all result in people not getting the care
that's
that
exactly
they
right.
deserve.
Yeah, that's exactly right. And when you start to take in different ethnicities, different cultures, different genders, all of these things, it gets more and more complex. It becomes an exponential problem. And just having a text-based question written in one language doesn't solve the problem. In fact, it exacerbates it.
And literacy rates, I assume, are variable.
Exactly. So by stripping out the text and making it more iconographic, you can start to transcend these issues and still normalize the data behind the scenes across a population, regardless of these variables and their demographics.
So I've heard the term digital empathy used with your company. Is it essentially trying to measure empathy using images and pictures so that digitally you can get feedback to figure out where somebody is at whatever point?
That's a great question. Actually, we see digital empathy, and it's a term that we've coined for use with this, is actually imputing the empathy into the design of the assessment or the survey. And it's not just the survey as a document, if you want to think of it that way, even if it's digitized, but the process. For example, you might consider, can this individual, given the context of the situation they're in, actually answer 25 questions before they become exhausted and burned out? Maybe we need to break it into 5-question blocks over a period of time.
So it's sensitive to the literacy level of the individual.
Correct, and the context of the individual.
Yeah. That's great. Eric, keep up the great work. Sounds like a really cool idea. Good luck with it.
Thank you.
Hope you do well.
Thank you, so do we.
Eric Gombrich, great to see you again.